Here, thank you both for being here. American Heart Association. I know you guys you're connected to Sutter, also connected to this very important cause, this organization that does incredible work, and it is Heart Month. We know that, so lots going on, a lot of things to talk about. Welcome in, first and foremost.
Thank you.
I didn't know if him yelling, you guys are ready to jump into action and save a life. I don't know.
Anytime.
Anytime and always.
Yes.
All right, so it is Congenital Heart Disease Awareness Week within Heart Health Month. You want to tell us a little bit about what that means for people? What should we be thinking about as we hear that?
Yeah, so congenital heart disease is when there's a structural abnormality of the heart or the major blood vessels. It's the most common birth defect, and it occurs in about 1 in every 100 live births.
Wow.
About a quarter of those patients have what we consider critical congenital heart disease, and that means that they might need some sort of procedure or intervention within the first year of life, sometimes within the first days of life. So it's really important to have early diagnosis.
You bet.
Right. And Christy, you were actually born with CHD.
Yeah, I was born with critical congenital heart disease back in 1980, and
1900 something. Yes,
No,
for sure.
1995. No, right.
I was born with about 5 defects of my heart, basically 2 holes, and I was missing the vessel that brings blood from the heart to the lungs. So you kind of need that one.
Yeah.
So my first heart surgery was at 3 days of age, and I've had 4 heart surgeries, most of them in childhood.
Oh my gosh. And how are you today?
I'm good. At some point I'll need my valve replaced, but thankfully I've grown with technology, and hopefully my next valve replacement will be done in the cath lab, and I won't need to have my chest cut open again. That'd be nice.
That would be nice.
Yeah.
I think we would all love that for you.
Yes, thank you.
Speaking of, the technology, the advancement in medicine just continues to fly. I can't even fathom what it's like for you to have to, both of you in this profession, to have to keep up. But it's also great for us, for the patient.
Yeah, it's really important, and actually, thanks to all these advancements, there are over 2 million people with congenital heart disease today, and over half of them are now adults because of all the wonderful advancements.
Wow.
And people are leading full lives. They're going to college, getting jobs, having their own families, working as nurse practitioners in the adult congenital heart disease clinic.
Yep, exactly. I might be an outlier, I think, but
It seems like something you'd really early diagnosis. I mean, as soon as you get it, it's got to be critical to get that early diagnosis too, right?
Yeah, and then also understanding that it's lifelong care. I think there's been this misunderstanding that it's just a pediatric condition, but and that happened to me when I was 18. My pediatric cardiologist, in the late 90s, was like, "I don't know where to send you, so good luck, have a nice life," which was pretty tough to deal with. And it wasn't until I was in nursing school that I was like, I think I should have somebody take a look at my heart. Went to the adult cardiologist and sat in the waiting room with 80-year-olds who had heart attacks and AFib, and I was like, well, this doesn't quite fit as a 27-year-old. Then I went to the pediatric cardiologist office and sat in the waiting room with 2-year-olds, and I thought, I'm here to talk about my pregnancy risk. I don't think this fits either.
Right.
So this new specialty of adult congenital heart cardiology, which Dr. Schultz is a board-certified adult congenital heart cardiologist, is a new medical field, like the newest medical specialty in 30 years, because we've done such a good job helping these children become adults. So
it's really important to just understand the importance of maintaining regular cardiology care throughout the lifespan, because depending on what the diagnosis originally was, there are different risks that we're keeping in mind and wanting to screen for and make sure that we're not missing, because a lot of people will need more procedures potentially throughout their life, and so we want to just be mindful of that in screening.
These are repairs, and repairs can break down. So
of course,
you got to keep on top of
Just
that.
like with anything else, right? Anything we think of, whether it's a car.
Check under the hood. That's right.
Exactly right. I'm sure you love the car metaphor. You're like, I'm a doctor. I don't need the
I don't use them as much as I could, but they're applicable sometimes.
Well, thank you both.
Yes, definitely.
Congratulations to you. What an inspiration too for so many people that are now living. Luckily, they're being treated the right way, but you helping other people, just absolutely terrific.
Help my peeps.
That's what it's all about.
Thank you both. Happy Heart Health. I'm glad we get to celebrate Heart Health Month, frankly, because of the advances and so many different things that are happening in the good way for people. Heart.org is where you can find some more information about the American Heart Association, Facebook, Instagram, the X, everything you need, all the information. And if you have questions, that's what they always want, is, hey, make that call, ask your doctor, get on the line.
Absolutely.
Get moving. Don't just sit.
Yep.
Yeah, absolutely.
Love it. Thanks, guys.
And a little bit of chocolate is okay for the heart.
Yeah, dark, especially dark.
Dark.
Absolutely.